Hi, my name's Nicole. I'm one of the collaborative care nurses for Team C at Cheshire Medical Center, Dartmouth-Hitchcock-Keene. Basically what we do as collaborative care nurses, it's kind of like a team approach, collaboration. You work with a bunch of different people. It's primarily targeted towards patients with stable chronic medical conditions such as hypertension, diabetes, and COPD. The collaborative care nurses get to take the time to work with patients. They really get to spend one-on-one time with patients that maybe the providers don't have because they only have those 20-minute book slots with patients. I have one girl who's my age. She's in grad school, and she is in grad school here, but her whole family's in Florida. And she came down here to establish care with with a provider here, and her A1C was super high. She's type 2 diabetic. Found that out when she actually came here, and her family didn't know she has diabetes in her family, and booked her appointment with me, put her on oral diabetes medication, started her on that. Actually started her on basal insulin, Lantus, and adjusted her medication. We talked every week. She was actually awesome. She emailed me her glucose logs every single week. We checked in every couple days. She was a very good student. She sent me all of her food diaries on what she ate if her sugar was really high. And we actually got her sugar, her blood glucose levels down to goal, which is what the provider wanted. And before she left to go home for winter break, she was, ready and okay, and was going to tell her mom and her family that she had diabetes when she got home. I've also done, patient may come in with a bag of medications and just may need some help. I have all these medications. I don't know when I'm supposed to be taking them. I don't really know what to do with them. Can you please help me? I've noticed that some of the patients that I have seen, particularly for diabetes, really enjoy this position. We get to sit down with them, review their blood sugar logs, review their diet, do the insulin teaching with them, and really take that time with them that their providers don't have because they have so many patients back to back, one after another. It's really important for patients to kind of get the groundwork and be educated about their chronic medical condition, whether it be hypertension, diabetes, COPD, whatever the problem may be, so they can be knowledgeable and be proactive about the condition instead of having to be reactive in the end. What really draws me to this position, me personally, is the fact that working in the emergency room, it was very busy. I didn't get to spend a lot of time with my patients, and being in this position right now, I get to take a lot of time with patients. I get to sit down with them, I get to talk to them, and that's something that I didn't get to do in my old position and that I really value that I get to do in this new position.